I would just like to say I am fully supportive of this initiative to build the Health and Science Center. My understanding is that it would double the amount of nurses that could enter the marketplace after their training has occurred. We just recruited this year 5 of some of your best nurses. One of them is training in our ICU. She's doing great. She's outstanding. All of your graduates have been that way. But you know, the number of recruits that we have is still not enough. So again, I just want to express support and encourage you to vote in favor of this because we truly do need it.
It's no secret, I think it's been drummed in everybody's head that there's a shortage of physicians out there in multiple specialties. There's a shortage of all kinds of healthcare practitioners, especially nurses. And I can tell you as a 30-year veteran of our industry, 3 years from now, you will not recognize healthcare in our country as it is. You will not recognize healthcare as you deliver it to your employees and students here at the university based on the changes. And the changes that are coming is a tsunami of regulations and initiatives to create more access and increase the demand for services. The Health Science Center with a technology and IT piece, which almost are hand in hand now with hospitals, home health, nursing homes. We need more and more institutions creating opportunities for students to go into these fields.
You need to know our partnership with you is very critical to the success of our own organization and then to our community. I need a pipeline of nurses. When we talk about shortages in ICU and ER and then again in OB, we're looking at nurses that we grow from a place where they learn a basic nursing skill and then move on to a more skill that requires just a little bit more education, a little bit more experience. We need to have the pipeline going and it needs to be full. We too have hired in, this year we hired in 6 new grads. Last year we hired in 9 new grads. I expect again as we move forward that we will continue that. We are at constantly a 95% hire, which means we are always in need of 5% more than what we have. And we need you, and we need to be able to have the nurses coming through this system. We need the building. We need to be a part of your solution.
I'm in favor of the Health Science Center. I think it's a great opportunity for CWC. With many students who can't get jobs coming out of 4-year schools or junior colleges, there's a direct infusion of nursing students. I think it benefits all of us. There are jobs available, so that speaks well of the program itself.
I've always seen CWC as Fremont County's best asset, and you've always risen to the needs of the community in the past, and I see no reason why you can't fulfill those needs in the future by building this new facility that will help fulfill some of the needs that we have. It will increase the ability of the community to recruit new physicians. I know that we've tried for 4 years to recruit a new physician and have just recently become successful at that, but there were many issues involved, not just the community itself, but the things that are available in the community, because physicians want to move where their families will prosper and they can be proud of the community they're in.
We are a community. We must support ourselves. We must build our own future. We can't look backwards. We have to look forwards. The CWC nursing program has over 300 declared pre-nursing students. Of those, due to facility failures, only 32 can be accepted into the program at once. This is a program that's nationally recognized and in the last round of examinations at 100% pass rate. It's a phenomenal program. It produces exceptional people. Why are we trying to constipate it? Why are we trying to shortchange it? Why aren't we using this to build part of our community?
If you look at the state of Wyoming and you talk about the shortages we have in this state, good times, bad times, we're always looking at nurses. It's a great career for people.
I'm a nurse today because I got to work full-time, raise my 2 kids, and go to school in the community in which I live. I was really glad that Central Wyoming was here and that Central Wyoming had the nursing program here.